Hello, everyone, and welcome to this podcast where we're going to be discussing the evolving pandemic. I am Dr. Daniel Griffin. I am the Chief of Infectious Disease for ProHealth New York, the Senior Fellow for Infectious Disease at United Health Group, and a Clinical Instructor of Medicine at Columbia University. And today I'm going to be discussing where we are with the vaccine campaign. We're going to be discussing a little bit about the impact of the vaccine on the epidemiology we're seeing. And then after me, if you'll stay tuned, the next episode, we're going to end up talking about vaccine safety. But let's start with where are we in the vaccine campaign? So about 18 months after we became aware of the virus that was causing COVID-19. Vaccines were quickly researched. And in December 2020 was when we first started to vaccinate people in large numbers in the United States. There was a goal, people are probably aware with this goal, to get 70% of Americans vaccinated, at least that first dose by July 4th. We came close. We were able to get a first dose into 70% of eligible Americans by August of 2021. That meant about half of the eligible individuals had completed their vaccine series, but about 70% had gotten that first dose. But as positive as that sounds, the vaccination uptake has not been even across the country. About half of our states are not above that 70%. About half of them made it. So we've seen unequal distribution of vaccine uptake. And actually, we've seen the effects of what that has done. So in the summer, in July 2021, as most people are aware, we started to see after July 4th, after a lot of large gatherings, we started to see an increase in cases. And what we particularly saw is areas of the country where there was low vaccine uptake, particularly in areas of the country down in the South. We started to see increasing case numbers. We also started to see increasing hospitalizations, and unfortunately, we're also seeing a certain number of deaths in those areas. The areas that have high vaccine uptake, we are not seeing as much. We still are seeing an increase, though, to be clear. Now, what is the effect of the vaccination on the prevalence of disease? In areas where people are vaccinated, we are still seeing that some people who have been vaccinated can get infected, can spread the disease. The CDC has shared that information and the numbers. But to be really clear, we're looking at only about 1 or 2% of the positive cases occurring in vaccinated individuals. The other is, I think, the really big aspect of vaccination. What about the impact on hospitalizations and deaths? When we look across our country and we're seeing rising hospital rates, well over 90% of those individuals that are ending up in the hospital are the unvaccinated individuals. So the vaccination has had a big impact on case numbers. It's had a significant impact on hospitalizations. But what about deaths? We look at the unvaccinated individuals with about a 2%, a 1 in 50 case fatality rate. But if we look at vaccinated individuals, we're looking about a 1 in a million death rate. So really dramatic impact on deaths, a really significant impact on hospitalization, and also very dramatic impact on the prevalence of disease, the case rates in areas where we're seeing high vaccine uptake, not so great in areas where we're seeing low vaccine uptake. We've always used vaccines to prevent against disease, keeping people from getting sick, keeping people from ending up in the hospital, keeping people from dying from diseases. But we've begun to realize that these vaccines may do a couple other things. They may have these other superpowers. They may actually prevent people from getting infected for a period of time after the second vaccine dose, maybe even after a third, as we'll come to. And they also may be helpful in blocking transmission. So there was a really nice study where we actually saw that if an individual in a household happen to get infected, we know the vaccines reduce the risk of that, but if a vaccinated person did get infected, their chance of spreading it to household contacts was significantly decreased. We've also seen data that should a vaccinated person get infected, even though the vaccines seem to be reducing the chance of even getting infected, it looks like that vaccinated person will much more quickly clear the RNA. So what are the choices right now, and where are we going with this? So the first vaccine that came out was our mRNA vaccine, the Pfizer vaccine, a 2-dose vaccine, still recommended to be separated by 3 weeks. Very quickly, this was followed with the introduction of the Moderna mRNA vaccine. This is a separation about 4 weeks between those doses. And then the Janssen & Janssen, and this is a viral vector vaccine that also was approved. Now, that is our 1-dose option in the United States. Little subtleties, little differences in the different vaccines. Pfizer was given approval down to 12 years of age. The Moderna and the J&J, the Johnson & Johnson Janssen vaccine, approval down to 18. Now, I mentioned down to age 12, but what about below 12? Because this is going to have an impact as schools open in the fall of 2021. We still at this point do not have approval for under the age of 12. The data has been collected. We are looking hopefully again in the fall of 2021, having the approval for vaccination down into those lower ages, which we expect to have an impact on the prevalence in our schools. And we also expect that to have a repercussion, an effect on the communities where kids are going back to school. The other impact of vaccination has been a lifting of mask mandates in a lot of areas. And I will actually present this as a challenging thing. Early on, I think we were very optimistic in June. As we went into July, a lot of areas, the mask mandates were lifted. Now, the mask mandates were really lifted for vaccinated people. But as we know, a lot of individuals, vaccinated or not, had masks off in those crowded areas. One of the things we are seeing, and I think this is really important with the vaccines, is in the first few months after the vaccine, we were seeing a significant impact on herd immunity, meaning a vaccinated person was at very, very low risk of becoming infected and very low risk of transmitting onwards. But as we've gotten months out, we've started to see, as those antibodies start to drop, we're starting to see a contribution here where vaccinated individuals are slowly becoming more susceptible to mild or asymptomatic infection, clearly seeing that vaccinated individuals can be part of the spreading. So that free lunch, that impact on herd immunity, we are starting to lose. So with that, we've had changes in recommendations. If we're looking at areas where the hospitalizations, where the case rates are going up, a lot of jurisdictions are starting to ask vaccinated people as well to play a part in the mitigation. We still, and it needs to be clear for vaccinated people, we're not saying vaccines don't work. We're saying they're incredibly effective at protecting you from dying of COVID-19, incredibly effective at keeping you out of the hospital, still quite effective at keeping you from getting sick with COVID, but not 100%. Vaccinated people can still themselves get infected, and even a vaccinated individual can spread it to others, including our loved ones, our children, our spouses, our aging parents, and the like across the border. So there's been a lot of nuance introduced. And I feel like Americans and physicians, we can all handle this. Is the vaccines are some of the most effective vaccines we've ever seen, but there's no sterilizing immunity for a long period of time. By sterilizing immunity, it's not as though the vaccines create a shield that prevents you from being infected at all. There still could be some degree of virus replication in the upper airways. There still could be some transmission. So the masks can add an extra layer, another public health intervention to help prevent the spread. So where do we see that we're going? Well, in about 7 months, as I've mentioned, about 70% of eligible Americans have gotten at least their first vaccination. And this is huge. When the polio vaccines were approved, it was 5 years before we got to 90%. We've gotten to 70% in over 7 months. So I think we can all be really, really proud of what we've done so far. There's been a lot of discussion about vaccine hesitancy. But if you look at that number has to be pretty small because 70% have already anteed up, have already made the choice to protect themselves and others. Now, one of the topics, I'll say a hot topic that has come up, which really has a lot of momentum behind it, is how long do these vaccines work? Will I need a booster? Will I need a variant upgrade? So let's talk a little bit about that. Where's that coming from and what's the science? And when we look over time, there's a couple things we see. One is there does look to be a decrease in the effectiveness of the vaccines the farther you are out from that second shot, from that boost. So do we go ahead and we do a third shot to increase that efficacy? So there is some science out there that if you get a third shot, those antibody responses, those T cell responses that protect us can become increased to higher levels. Well, on the 12th day of August 2021, the US FDA actually said, let's look at boosters. Let there be boosters. And this was for both the Pfizer BioNTech COVID-19 mRNA vaccine and the Moderna mRNA COVID-19 vaccine. Now, their suggestion was that we allow the use of this additional dose for certain immunocompromised individuals. And the CDC quickly came along to define who are those individuals that we are talking about. And the CDC recommended that those moderately to severely immunocompromised individuals that we're talking about for that third shot, that booster, that second booster, include people who have been receiving active cancer treatment for tumors or cancers of the blood, an organ transplant recipient who's on medicines to suppress the immune system, an individual who received a stem cell transplant within the last 2 years or taking medicines to suppress the immune system, certain people with severe primary immunodeficiencies, individuals with advanced or untreated HIV infection, or individuals that are undergoing active treatment with high-dose corticosteroids or other drugs that might suppress the immune system. So this is all, I think, interesting news. And what we heard is rumblings at this point, a suggestion that boosters may actually even be extended to the general population. On Monday, August 23rd, 2021, the U.S. Food and Drug Administration gave full approval, so licensure of the first COVID-19 vaccine, and this is the Pfizer BioNTech COVID-19 vaccine. There also are not just a third shot of an mRNA vaccine or not just another shot of the vector-based vaccine to give you that boost, but the pharmaceutical companies are even working on variant-specific booster shots. So this will be a special shot that increases your ability to respond to the changing viruses in the future. A lot of us think it's really just a matter of time before that is embraced. But there's science issues and there's equity issues. What is the best way to keep an individual who's received their full vaccine series safe? It's to get as many people around them vaccinated to decrease their risk. So there's a balance between the science, there's a balance between the public health perceptions, and there's also a balance between equity. Much of the world has not even had a chance to get that first shot. So a lot of developed countries are looking at themselves in the mirror, so to speak, and saying, if we're going to be moving to getting thirds, we've really got to do everything we can to expand production so that the entire world can get access to these wonderful vaccines. Because as we like to say, no one is safe until everyone is safe. So as we go forward, what are the next steps? We've moved away from those mass vaccination campaigns. There's a lot of pharmacies that are pulling the weight here. We're actually getting the immunizations, the vaccines, into physician offices, into pediatrician offices, where people can have those discussions. There's a distinction here that I want to make between the the anti-vax and the vaccine hesitant, a lot of people want to ask questions before they get a vaccine. Maybe they have a certain health problem that makes them concerned. Maybe they've had a bad reaction to something in the past. Those discussions are going on, and we continue to vaccinate hundreds of thousands of Americans every day. So the vaccine campaign has gone well. The vaccine campaign continues to go well. We continue to get a lot of focus on education, which actually this is part of that, letting people know what's going on, answering their questions about the vaccines, answering the questions about options. In our next episode, you're going to hear a bit more about vaccine safety, which we're doing a lot about. Unfortunately, we have realized that COVID-19 is here to stay. It's not going away. So the choice for so many is the choice between waiting, getting infected with SARS-CoV-2, getting COVID-19, the disease, versus preventing that with an immunization. So the risks and benefits are balanced that way. So in our next episode, we'll be talking, well, what about risks affecting my heart? What about blood clotting? What about these other things I've heard about? And the big thing that is driving our vaccine campaign forward is the realization that these vaccines are much, much safer than waiting and getting COVID. A huge thing we are hoping that the vaccines give us, in addition to this dramatic decrease in your risk of death, a dramatic decrease in your risk of hospitalization, a significant reduction in your risk of symptomatic COVID. But we are also hoping that these vaccines play a major part in preventing people from getting what a lot of people have now become aware of, the post-acute sequelae of COVID, the long COVID, I got COVID, I was sick for 2 weeks, now I'm still sick 4 months. So I'm going to finish on that note just to say we are doing a great job. I anticipate we will continue to do a great job in coming months. And please stay tuned for our next episode where we'll discuss vaccine safety.